ABR stands for Advanced Biomechanical Rehabilitation and is a biomechanically based approach used to treat spinal injury amongst other serious neurological conditions such as cerebral palsy and brain injury. ABR therapy was invented by Leonard Bloom, whom I have worked under since 2001. Through ABR therapy, we seek to rebuild the depleted core structure of the body by restoring proper tone to the smooth muscles of the internal organs, so regaining quality and volume to the foundation of our bodies. The result is a cascade effect which realigns the skeleton and brings hydraulic quality back to the joints. This in turn improves muscle tone and increases muscle mass. The normalization of the legs, and also the arms in the case of tetraplegics, will remind the brain of their existence, re-establishing the damaged links and eventually bringing function back to paralyzed limbs. The key to ABR therapy is to bring about structural improvements in the musculoskeletal system, from which motor function develops as a spontaneous result. ABR does not seek to train the body through muscular effort. ABR employs no surgical intervention and does not use drugs. It is a gentle, hands-on approach that delivers repetitive mechanical inputs into the system to revitalize depleted structures. Many consider that recovery from spinal injury would only be possible by repairing the spinal cord. Such a view, however, takes no account of the structural collapse of the body. In ABR therapy, we pay no direct attention to the nerve damage, as we do not see this as a barrier to recovery. Instead, we see the depletion in intrinsic capacity of the core structure as the primary essence of spinal injury, and so seek to rebuild that capacity as the basis of recovery. By addressing the body in this way and improving the musculoskeletal structure, we can spontaneously regain motor function, showing that the body has the ability to re-establish nerve pathways despite serious damage to the spinal cord. Just how the body does this need not concern us. ABR uses various hands-on techniques to generate quasi-static inputs into the body. By delivering such slow, gentle inputs into a passive body, we avoid a reaction at the surface and manage to stimulate the deep structural levels, so regaining tone to the smooth muscles and improving the intrinsic capacity of the body. There is some work I can do on myself, but most approaches require someone else to deliver the therapy while I lie passively on a bench. So how does ABR therapy work? The body is made up of many entities and many layers, but there is one thing that is common throughout the entire structure, and that is connective tissue. Connective tissue pervades through the skin, the muscles, the bones, and all the internal organs in an interconnective web known as fascia. ABR therapy induces quasi-static strain into this fascia network, working right down to the cellular level, creating tension in the collagen fibers, which wakes up the fibroblasts that do their work to beef up the cellular structure, giving volume, density and pressure to deep levels of tissue that have become depleted and dormant. In this way, we little by little rebuild that intrinsic capacity to our core structure, so restoring the musculoskeletal system and bringing life back to a paralyzed body.